for us. Please stay muted to avoid background noise. If you have a question, feel free to chime in. There's not a lot of us tonight, so feel free to chime in, raise your hand tool, or add a question to the chat, and Steph will get to you. If we want to make sure, like Sarah said, that we remain mindful of your time tonight. So if we don't get to your questions that you have submitted in the chat box or prior to coming tonight, we'll make sure that we get back to you. Without further ado, I'm excited to introduce our CEO and President, Sarah Struwe. She'll be discussing the impact of your donations made in 2022 and how your support will help us make an even bigger difference in the years to come. Thank you for being here and for your unwavering support. And please join me in welcoming Sarah Struwe.
Well, hi, everyone. It's great to see everyone virtually at this point in time. Wanted to just chat a little bit about the growth that we've seen from our revenue over the past few years, thanks to generous donations by people like you. Last year, we had a 31% increase in our revenue that we raised, which allows us to do much more with the funds that we have. The 20 and 21 years were years of COVID, and to be quite honest with you, we were like all the other nonprofits at that point in time who saw steep declines in everything that was happening because of the pandemic and the inability to do things in person. We've started moving things back in person again last year. We held our Till on the Hill this year. It was virtual, and it's probably the last totally virtual event that we'll do. We're looking at how we can do virtual as well as in-person events in the future. So that's a little bit about the revenue that we've raised over the past few years. And your impact is really what we want to spend a lot of time talking about. So part of the impact that you've had as a donor is really to help us enhance communication and outreach to people. One of our goals at SBA is to make sure that we try to include our community in everything that we do, in all of our messaging and all of our decisions. And everything that we do, we try to engage our community to get a bead on what they want and what they need. And one of the places that we spent a lot of time over the past year is in the clinical world, trying to make sure that we're getting our clinics and health providers updated so we can have that information on the website. One of the things that we're trying to make sure that we do is get names of adult care providers that are providing care for adults and include those in the database that we're building so that we can help people who come to us who are looking for providers. And hopefully over the next few years, we'll see that grow. We've also pushed a new research and educational opportunities and other information to healthcare providers and researchers. You know about the clinical care meeting, that's one of the avenues that we use, but we've also spent time trying to develop newsletters, increasing our listserv and doing other things as well to try to make sure we're keeping that community involved. And our community has really reached out to the National Resource Center. It sounds really fancy, but to be honest with you, it's one person, Juanita, who answers all of those emails, all of those telephone calls. And so far, she's had, in last year, over 350 interactions with people who are looking for medical device and trying to get relevant information for their families and for healthcare professionals and others who live with spina bifida. And again, it's one individual who does all of that work. And one of the other things is we use our walk and roll as an opportunity to outreach to our community. We had a very successful walk and roll year in 22. It was our largest revenue raiser and friend raiser that we've had thus far. So we raised over $500,000 in total for the walk and rolls. And then we've also raised many new friends as a result. So it's been a great opportunity for us. When we talk about the things that we do in communication and outreach, there are a few things that are really important to us. We have listserv group, one for healthcare providers and one for researchers. And we also do a program called SB Connect, which is really designed for support groups in areas where we don't have chapters. it's an opportunity for people to connect with others who have spina bifida so they don't feel quite so alone. And then there's SBU. SBU is our adult learning platform that's by and for adults with spina bifida. We do basically about 4 sessions a year that they literally plan and help execute. And they're recorded, they're live when they're first offered. We record them, and then people have the opportunity to check in anytime and be able to listen to that content. And we're looking at ways that we can actually improve upon that so more people can use it. We've also, with the National Resource Center, have connected with the Child Neurology Foundation, and they have invited us to use to work with an organization called Unite Us. And basically, it helps us to really increase our resource outreach. It's another resource platform that Juanita can actually refer people to help with things like housing and other things that are of importance to them. Of course, we've done a series of education days. We're planning on this year actually taking those and editing them and making the content available instead of holding them in person. But last year we held 4 of them. And they are well attended and they're full of information. And when we do an education day, we typically partner with clinics in the community to actually provide the content. So it's a great way for us to provide education to people with spina bifida, but also to build connections with clinics and healthcare professionals. And of course, our chapters are a huge part of our ability to outreach and to communicate. Without them, we wouldn't be able to do a lot of the things that we do. And then walk and rolls, of course, is a way we reach a lot of people. One of the things I'm most proud about is our research gap work. A few years ago, we did a survey that asked people within our community to identify the areas that had the greatest impact on their daily life. From that, we built, and the questions and the gaps came from our healthcare guidelines that we had developed. And so we asked the community to weigh in, and they helped to prioritize. We have 6 topics that we're working on. We've now taken a group of volunteers who are researchers, healthcare providers, adults with spina bifida, and parents, and created the Research Advisory Council. And it's something that we're really proud of because it's putting community-sourced research in the hands of people who have to live with what the results of the research are. And so we're really proud of that. We've also done some work on our Professional Advisory Council. It was just a small group of people who were doing a lot of work, and we wanted to open it up to more people. So we took a look at its structure, created 4 committees that now report to the PAC and are doing work on research, on the healthcare guidelines, making sure that they're updated, on adult outreach and professional outreach as well. So we've got a large number of people who are helping us in those arenas. We continue to review and update the guidelines for the care of people with spina bifida. It's an ongoing project that happens, thankfully, with the help of volunteers, almost without us knowing it. They do a lot of the work, and then we get to clean it up and put it in its final format. And then the last thing also came from the research gap work that we did. One of the things that was identified as bowel incontinence is one of the hugest impact on people with spina bifida and the quality of their life. And so one of the things we did was develop a lifestyle bowel management protocol. And it's been presented for the first time. It's going to be presented again at the World Congress. And so we're really excited about that. Other key components in this arena are Project Echo. That's where we're taking a synchronous learning platform called Project Echo, and we're training physicians about spina bifida. We're doing this in a test project phase, and we're going to learn what we can from this so that we can see if we can build upon it to train more people about spina bifida. And of course, our community and advisory councils continue to help us identify gaps in care and research. Our Professional Advisory Council is the key component in this, and it's our clinical care meeting. So The National Spina Bifida Patient Registry, which is housed at the National Center on Birth Defects and Developmental Disabilities at CDC, is one of the things that we work to make sure gets funded on an annual basis. But we not only work to make sure it gets funded, we also work directly with the registry participant, the clinics that do the registry and CDC. And one of the projects that we're working on is taking clinics that have some of the best and some of the not greatest outcomes and trying to see if we can ascertain why they differ. What are they doing differently? What about each of those clinics really can have an impact on how the outcomes of people within their clinic fare? And so we're starting to work on that. We've identified clinics. We're about ready to gear up to start visits, and that will happen in this year. Another thing we've done is developed a clinic care partner program that gives some basic standards to clinics. And currently we have 38 clinics who are participating in that. They get a plaque from SBA that recognizes them as being a care partner. But we know in doing that more about what they do. We know that what they're doing in terms of transition. We know how they're using our guidelines. We know a lot of things thanks to this program that we wouldn't have known otherwise. Part of the National Spina Bifida Patient Registry is the CDC. We have close relationships, like I said, with the National Center on Birth Defects and Developmental Disabilities. We do receive some funding from them as well, but we work very closely with them with the programs that we work on, but also just in general to make sure that that center receives funding. Another key component is the Adult Advisory Council. We couldn't do a lot of what we do without the help of our Adult Advisory Council. They guide us through a lot of different things and help us to develop programs relevant to them. And of course, SBU is a big project that they're involved in, and it's one that we're really proud of. And the clinical care meeting, again, is how we take what comes out of the registry and make others know about it. Advocacy is my other favorite thing. I'm not going to lie. I'm really proud of the fact that we started Teal on the Hill 6 years ago, and it's now becoming something that's known on Capitol Hill. What we've done last year was we supported the Work Without Worry Act. It had to do with Social Security and whether or not you could have a job while on Social Security. And it was trying to actually improve the regulations that would allow people to be able to work a little bit more so that they wouldn't live in such poverty. We did also get a $500,000 increase in funding for the National Spina Bifida program that went through one of the houses, but unfortunately it didn't make it through the reconciliation, so it didn't happen, but at least in one house we did. And we also attended 80 meetings last year virtually with over 100 advocates. So it's one event we're very, very proud of. And of course, its key component is that event. It happens in the spring, early spring, late February, early March, typically in appropriation season. And then we're also working to develop volunteer ambassadors that are working on advocacy with us. So with that, I'm going to turn it back to Jenna.
Thank you, Sarah, for that inspiring display of what our donors' dedication does to ensure we improve the lives of those affected by spina bifida. We now have the pleasure of hearing from our Chief Operating Officer, Mike Wood. Mike will be discussing SBA's strategic plan for 2023 to 2025 and how your continued support will help us reach our goals. Please join me in welcoming Mike Wood.
Hi, everyone. I really appreciate you taking the time to be here this evening. And for those of you who are listening into the recording, I appreciate you taking the time to listen in and hear a little bit more about what we're up to and especially what you're enabling us to do. We absolutely could not do any of this without you. It goes without saying. We have just put together a new 3-year strategic plan, and we spent a lot of time working on this plan with care partners, people living with spina bifida, clinicians. We worked with our chapters, with other voluntary health agencies that we partner with, with our government partners. We really wanted this to be a plan that was a shared plan of action, because one of the things we know is that we will not solve the problems and address the barriers that are getting in the way of people with spina bifida having the care they need if we don't work together. So we really wanted this to be a shared plan of action. And we focused on making sure that the plan was framed around a set of outcomes that were externally facing. We did spend some time working on what we need to do internally and as a system that would enable us to execute these goals, but we really wanted this to be a forward-facing plan that was focused on some clear outcomes that we could rally around and leverage all the tools that we have in advocacy and programs, in public education and awareness and in research, to bring those things to bear to actually address these issues. So our first goal is around reducing the adult care gaps that people with spina bifida face. We have made a lot of strides in improving the care for people with spina bifida up until they reach about the age of 21. There's lots more to do there, but just to give you an idea of the challenge, there are about 100 pediatric spina bifida clinics and only about 30 adult clinics in the country. On top of that, primary care doctors often have challenges in coordinating care for people with spina bifida because they simply don't understand all of the issues that people with spina bifida are dealing with. And care has not kept up with the increase in the adult population. Out of 166,000 people estimated that live with spina bifida in the US, 2/3 of those are adults now. And so the population has really shifted. And what happens is that people fall off of a care cliff when they age out of pediatric care. This came up consistently in our conversations as something we really needed to focus on, and we're trying to do something about this. So over the next 3 years, we want to make sure that people with spina bifida, adults in particular, have greater access to quality health care, to providers that understand their condition and can coordinate their care, to the equipment they need, affordable medication, and the durable medical supplies that they need in their daily lives. We're going to do that by increasing the number of adult care providers who actually understand and can treat people with spina bifida across their lifespan. We are doing it through advocacy, so making sure that insurance payment policies allow for the coverage of the care and the supplies that people with spina bifida need. We also want to make sure that we are doing everything we can to make sure that people with spina bifida are being connected to those providers. So making sure that we're collecting up the information on providers that can provide this care and that we are sharing that as aggressively as possible. So we're putting together a set of strategies to actually address this issue. We're going to be building Spina Bifida 101 training that clinicians can take. We're working on that right now. We have a model that we're now going to be looking at and adapting so that we can put something together that clinicians can take and get continuing education credit for. We are generating resources to develop an on-call consultation so that people like family doctors and others who are treating people with spina bifida can call and do a consultation with someone who's a medical provider who's knowledgeable in treating people with spina bifida. We are continuing to advocate for increased telehealth options. With a population of 166,000, spread around a country with 330 million people, there's no way we're going to have enough clinics. So we have to make sure that telehealth is available for everyone. We're going to continue to advocate for increased insurance coverage for people with spina bifida. We do that through direct lobbying. We do that through sending letters to insurance companies. We've done research on insurance reimbursement, and we've used that data to try to push insurance companies to change their reimbursement policies, and we're going to double down on those efforts over the next few years. And then we want to do more to improve our information and referral services. So doing a better job of coordinating with our chapters and with other people and other networks to pull together the number of doctors and other medical providers that are knowledgeable in treating people with spina bifida and making sure that we're making that knowledge and information available. You all are enabling us to do this, and I can't emphasize that enough, and thank you enough for that. Your support is making sure that we can gather those lists and then we can make that information available. We're working right now on a website redesign that I hope will include information that makes it even easier for people to find doctors who are knowledgeable in the treatment of spina bifida, so that they can be empowered to help find doctors that can treat them more effectively. Your support also makes sure that we can continue advocacy efforts so that we can continue to lower the costs of medical care for people with spina bifida, making sure that they can get more access to medical supplies and again to the treatments and care that they need. That advocacy is a huge part of what we do, and it's incredibly important. So that's sort of at the adult end of the lifespan. We're also putting a stake in the ground at the beginning of the lifespan, because one of the things that we know, and this consistently came up in our conversations, is that there is a serious challenge in terms of how the diagnosis of spina bifida is delivered to expected parents. And what we found is that oftentimes when that diagnosis is delivered, parents aren't getting a complete picture of what their care could look like, what the outcomes for people with spina bifida can be. And they're essentially being told that their child, if they choose to have the pregnancy, will have no quality of life whatsoever. And as you can imagine, this creates trauma for parents that extends beyond the birth of the child into how they interface with their child, and creates all kinds of stress for the family and trauma really over years and years and years. And so we want to do what we can to try to change that experience for parents, so that parents are equipped with the knowledge and all the information so that they can make more informed choices, and also so they can know that if they have a child with spina bifida, that there are supports available. And so we want to make sure that they get a complete picture, and that they, if their child is born with spina bifida, that within 3 months they are connected to a spina bifida clinic. We are doing that by developing new tools that will help empower parents to ask better questions and to make sure that they're getting the support that they need. We're also developing tools that we're going to be working with partners on to make sure that they're getting in the hands of OBs so that we can change that diagnosis. We want to increase our partnerships with spina bifida clinics, obviously, because that's a key way that people are getting the care that they need. And we also, over time, want to work with medical schools to change the way that spina bifida is taught, because right now it's still primarily being taught as a pediatric condition. And what we're told is that it's often just a paragraph in medical school. And so we really want to change that. Again, your support is enabling us to do this work. For example, we'll be able to increase the number of OBGYNs that are actually using the tools and the protocols that we're creating. We're creating them with an organization called Lettercase. And again, as I mentioned, we're also creating tools for parents. With your support, the number of babies born with spina bifida, those babies that are actually connected to a spina bifida clinic will increase. We're going to do everything we can over the next to make sure that more and more of those children are connected to a spina bifida clinic. The clinic funding itself actually increases as a result of your support. As Sarah mentioned, we're continuing our advocacy efforts to increase funding for the CDC Spina Bifida program. And that program, in addition to research, helps fund those clinics. And so with your support, we're able to engage in those efforts that has a direct positive impact on the clinics and therefore on the lives of people living with spina bifida. So our third goal is really around building a sense of community for people living with spina bifida. And I've been at the Spina Bifida Association about 15 or 16 months now. And in that time, I have literally lost count of the number of people living with spina bifida who have come to me and told me that up until they engaged with the Spina Bifida Association, they didn't know anyone else with spina bifida. And that's a huge challenge. It affects mental health. It affects their ability to get the resources they need, to find answers to problems. to build their own sense of community and self-worth, it's a huge issue. And so we want to make sure that we're doing everything we can over the next 3 years to make sure that more and more people living with spina bifida and their care partners are connected into networks so that they can support one another, educate one another, and build a sense of community and belonging. I had a person last year at the clinical care meeting who came up to me and said, were it not for the Spina Bifida Association and being able to connect to other people living with spina bifida, they could consider taking their own life. And that's unacceptable. And your support is making sure that that doesn't happen. So it's not hyperbole to say that the support that you're providing is literally saving people's lives. And I can't thank you enough for that. And we want to do more over the next few years to build community. So part of what we're doing and working on this year is actually developing a needs assessment, because we want to go out and ask our community, what are the best ways that we can actually connect you and network you together? So we're going to be working on that this year. We're going to be increasing networking opportunities at our conferences, at workshops. Now that we're past COVID and we're moving back into more face-to-face opportunities, we're working with our chapters to make sure that we're increasing the programmatic opportunities that we have in our chapter areas so that people can actually connect physically on the ground and build community. We're working with our walk-in roles to make sure that not only are they effective fundraisers, but to Sarah's point, we're fundraising and we're friend raising. And so we are really working to make sure that those are deliberate community building opportunities. We also have an SB Connect program, which is a series of support groups that exist around the country. Some of them exist in chapter areas, but a lot of them are happening in places where we don't have any chapters. And so that's one of the great benefits, I think, to an SB Connect, is that you can build a support group anywhere in the country. And so we want to continue to figure out what's the best way that we can support those and grow those and strengthen those over time. So again, your support is hugely important in our community building efforts. Your support is enabling us to create more and more opportunities for individuals to connect with one another. Again, we're trying to do more and more of that in person, but technology is enabling us to do that online. And so we have a number of support groups, and we hope to sort of grow the way we're able to curate information and engage and grow those groups over time. The people who are being supported in our chapters are also increasing because of your support. And that's, again, that's really, really important. We're going to continue to grow those programmatic opportunities over time. We've started this year now that, again, that we're past COVID, and we're going to continue to figure out ways that we can do that. So the fourth goal is really around improving the evidence that's available and closing the evidence gaps that exist. There are huge evidence gaps, and some of you I know that, but it's a huge challenge for us. You know, we talk about the fact that there are 166,000 people living with spina bifida. We don't actually know what the number is. That's an estimation. We don't have great data available. Even though the Spina Bifida program has developed a registry through the CDC, only 11,000 patients are in that registry right now. And so we have challenges in developing and getting more funding so that we can grow the number of people in that registry and also get better data and start asking more questions, for example, around mental health and other areas. So we want to grow the evidence base over the next few years and address those evidence gaps that exist. We're going to do that through a number of ways. We're going to, as I mentioned, we're going to continue to advocate for increased funding for the CDC Spina Bifida program, because they have a registry, and the more clinics we can get into that registry, the more data we're going to get, and the more funding that they get, the more questions that we can ask. That's probably not going to be sufficient for what we need. And so over the next few years, we want to generate resources to develop a patient-reported outcomes registry that's the Spina Bifida Association would actually manage. And so we're talking with experts right now that develop patient-reported outcomes registries on what the best way is to go about doing that. We've already started having conversations about the kind of data that we would want to include. But over the next few years, we're going to be generating resources to do that work, because the CDC's registry is going to have to be augmented with some additional data. We also want to continue building out the community center research agenda that Sarah was talking about earlier. So we have 6 research areas. These were developed with our community, which I think is really important. We have groups of experts that are developing questions around those research areas. We want to continue to find researchers who are interested in doing research around those questions, and then connect them with resources so that we can enable that research. And also want to continue to put that agenda in front of the research community so that we can influence other work that's happening in the research world. So that's a big important part of what we're doing. Here's how your support helps us do this work. It allows us to do more research on spina bifida and get that work published. We're doing a lot of that at the World Congress this year, but we want to get more and more of that research out into research journals and develop other thought pieces so that we can influence the research agenda and also build public awareness around the issues that we care about. I think the biggest thing that your support is doing is, again, helping us do the advocate work that is so important to what we're trying to do. And that is going to allow us to get more patients, again, into the spina bifida registry, which is so important. We've got to get beyond the 11,000 patients, and we also need to be asking more questions. And it's also going to enable us to develop this patient-reported outcomes registry that is so important to the work that we're doing over the next few years. So those are sort of the big externally facing goals that we have. Again, I mentioned that we have some other internal goals that are enabling us to do this work, but that's really the work that's externally facing, and that's going to have the biggest impact on people living with spina bifida. And it's really what we're going to be focused on over the next few years. So with that, we can take any questions that you have.
Hey, this is Jay Whitehurst. First off, I really applaud you all for creating a new long-term plan. I think it's really important to have a direction that you know you want to go, and I applaud all of your steps. Can you or someone talk for a few minutes about the relationship between the National Association and the local chapters? We're probably not unique. We've got a grandson in California born with spina bifida, and that's really what's brought us to you and to Jenna. And so I'd like to kind of get a feel for how the local associations are doing, and how some color on your interaction with those associations, particularly California in my selfish case. Thanks.
Yeah, happy to talk about that. Our network is a hybrid system in that we have a number of separate 501c3s that are affiliated chapters that are part of the Spina Bifida network. And so there are 10 of those. And then we have 3 major areas that are what we call corporate chapters. And California is one of them, Georgia, Tennessee is another, and the Carolinas is the third. And those chapters are actually part of this organization, Spina Bifida Association, the national organization. And so we work very closely with them. And I look at the chapters, and Sarah, you feel free to jump in, but I look at the chapters as really our connection to people with spina bifida on the ground. A lot of our chapter work is really focused on creating more community building opportunities, creating more programmatic opportunities so that people can connect with one another and get education. We offer grants and for people that have issues and need extra support. we're also increasing and working on figuring out how we can do more state level advocacy, because so much of healthcare, especially with Medicaid, happens at the state level. And we know that a lot of people in our community are on Medicaid. And, you know, if you have to go to a spina bifida clinic and cross state lines, your Medicaid in a lot of cases doesn't work. And so we're trying to address that. You know, I guess the other thing I would say is that we're working. One of the things that we're trying to do is become much more integrated with our chapters, so that we're doing all of this work together. And so that's why we brought them into the planning process for this strategic plan. They helped us create it. We built it together. They were a huge part of shaping this. They were actually the first people we spoke with, and sort of their influence is all over this plan, and they've developed their local plans in a way that actually flows from this plan. So we're going to be, I would say, over the next few years, we're going to be working together much more closely in executing all of the things that we just went through.
Thanks. That's great. I appreciate it.
No problem.
Thank you, James. We got your note. We appreciate it.
And also, just to your question, Jay, if there's anybody, my email is mwood@sbaa.org. So if there's anybody in particular, anything in particular that you're interested in, or you want us to connect you with anybody in our advisory council in California, or, you know, if you want any more information about the work that we're doing there, just reach out to me and I can get you anything you need. This is, I think this year we're really, we just hired a new national director of field relations, and one of the things that I've talked to him about is making sure that we actually increase the programming that we're doing on the ground this year. And so we've been meeting with the chapters to figure that out, and we're actually going to start looking at each state and sort of dividing it up into, Sarah and I have talked about this, almost like the Girl Scouts use a model where they divide up the states into service areas. And we're going to do something similar here, because I want to make sure that in every part of every state where we have a chapter, that we have a number of volunteers who are playing key roles, so that, you know, for example, you know, you might live in, someone who lives in San Diego. I want to make sure that there's someone in that part of Southern California that they can connect with for support, because obviously they're not, you know, they're not going to be able to get in the car and drive to Sacramento. So we need to make sure that we have people in every part of these states, and so we're working on that too.
Thank you. I'll do that. I'm going to reach out to you and Jen, I think, to talk about how we could be supportive of the, you know, the long-term plan. Thanks.
Great.
Thanks, Jay.
Ramu, do you have a question, or did you want to?
Yeah, this is Ramu. I'm an adult, employed adult with spina bifida, living in Georgia, and I just want to say thanks, Mike, talking about chapter work. The Georgia Tennessee chapter is a corporate chapter. I do want to remind that Georgia used to be a 501c3 affiliated, and seeing SBA Nationals 50 years, the Georgia was created in 1976, only 3 years after the Nationals. Remembering that history, whether or not there's a 501c3 in the state of Georgia anymore, there's still that community and history. And I just also wanted to explain some things that I've shared in other settings about like a walk and roll, saying a specific city in a state. It's not just about the funds, but it is about the friends raising as well. Like you were saying, that Georgia's not as big as California, but if someone doesn't live near Atlanta, Georgia, but they live in Georgia and they see a walk and roll in Atlanta, we don't want them to think that the community is not serving them simply because they don't live in Metro Atlanta. And there's similar things like that with other states. But my question was about the patient reported surveys. How what's the plan for, like, how is that going to be done? Maybe that's still to be worked out, but I'm curious what's the current thoughts.
So one of the things, Ramu, that we'll do is we'll build a steering committee, for lack of better words, that will help us design the questions. And it won't be just professionals. We'll have adults as well as parents that will join us in this effort. And what we'll do is we'll sit down, we'll look at what we're trying to accomplish, what we're trying to get, start looking at what software we need to utilize, if we need to work in partnership with an academic institution, and if so, who would that be? You know, there are lots of questions. There's a whole framework around building registries that AHRQ has put together. There's a monograph for it. And so we'll just utilize that monograph to make sure that we actually follow all the steps. But the first step is pulling together the people and deciding exactly what it is we want to collect data on and what we're going to use it for.
Yeah, one of the things
Thanks.
that we started, we met with our medical directors actually last summer and just started brainstorming about this. And what's clear, I mean, we sort of knew this already, but in the brainstorming, it was just really interesting and sort of in some ways shocking just how much information would be beneficial that is not being collected. And
Right.
so I think the challenge is going to be really working with the community and people with spina bifida and care partners, figuring out among all of that data, potential data we could be collecting, what's going to be most beneficial.
Yeah. And I think the other thing too is we don't want to give the impression that we're not going to be supportive of the National Spina Bifida Patient Registry, because we are. That work needs to continue, but it's a very specific registry designed for a very specific purpose. It's really focused on 4 outcomes, and they're following very closely people in those outcome areas. But we have lots of questions beyond those outcomes that we need answers to as well. And this will also give us an opportunity when people age out of a clinic, they can then go into the other patient reported outcomes registry, so that we can follow them for a longer period of time. Because right now, once they age out of a pediatric clinic, if there is no adult clinic that they move into that's in the registry, we lose them. We lose all of those people, and we don't know what's happening with them. So we're trying to think about how we can augment what's being done at CDC as well too. So that's what we've been thinking about with it.
Do a last call for questions, if there's any.
I know someone like Dr. John Wiener definitely has TikTok, so we put together a slide in case you're not following us on any of the socials, and you do participate in social media. Here are all of our handles. And then additionally, I know majority of you on the call, but those of you who are watching the recording as well, here's my email, and reach out. Please feel free to reach out whenever. Again, we'd like to thank all of you for joining us tonight, today, whatever time of day it is while you're watching this or wherever you may be, and for your unwavering support of the Spina Bifida Association. Your generous donations allow us to continue our mission to build a better and brighter future for all those impacted by spina bifida. We could not do this without you, as you well heard tonight. Thank you guys, and good night.